Welcome, everybody, to this training on motivational interviewing in the stages of change. Very excited to be back with you, see some familiar names and faces. That's always exciting. Um, this is a very commonly requested training for us. So I want to kind of give you the groundwork of who we are and where we're coming from and why this fits so well into our wheelhouse. If you didn't attend our last session, we're coming from an agency called Pathways to Housing PA. It's in Philadelphia. We use the housing first model to work towards ending chronic homelessness. And so we've been doing that work here in North Philadelphia since 2008. We're housing close to 600 folks in that scattered site model of housing first. Have had a ton of success over the years using heavy doses of harm reduction and motivational interviewing to make that work. And in fact, as an evidence-based practice, housing first includes the practice of motivational interviewing. So we're a real like matryoshka dolls of evidence-based practices here we're dealing with. And this is one of my favorite topics to talk about. I think it's so fun. I think there's so much depth. We can really plumb the depths of motivational interviewing and always find more to talk about. As for myself, my name is Ryan Villagran. I use they and them pronouns, and I'm a training specialist with Housing First University, which is like the training, outward-facing training and education institute operating under Pathways to Housing PA. So I get to spend my days talking with folks like yourself in various communities across the country about housing first, about harm reduction, and other best practices for service delivery. And that's motivational interviewing. I'm ready to stop talking and pass it over to my co-presenter to introduce himself.
Sure. Thanks, Ryan. Good morning, everybody. My name is Khalil Martin. I am a therapist in Philadelphia. Before I made it to the clinical space, I was actually working at Pathways with Ryan as a training specialist. And before that, I was working on the polysubstance use team at Pathways. So doing some of this work and moving our folks from the street into their homes, and then supporting them from there. Most of my experience before the therapy spaces in substance use and homelessness settings. So yeah, that's me. Excited to be here.
Some really quick housekeeping, just inviting folks to be present with us. We love to kind of like poke at the audience a little bit. Hey, what do you think about this? Hey, answer this question. Hey, let us know that you're out there. And so we're just inviting you, if you can, to flip over your phone and close out your Outlook if it's possible. I know when I multitask, I do both things really poorly. So that's my feedback to you. We are welcoming questions and comments throughout. Would love to engage in a dialogue today. Don't want to be talking at you for 2 hours. And so I'm welcoming folks to use the chat. We don't have a ton of people in the room with us today. And so with that said, I'm inviting folks to raise your little Zoom hand. And if you want to open up verbally, open up your mic, we welcome that as well. We are offering CE credit for social workers. And so if that's you, if you're a licensed social worker, a couple things we need you to do. We need you to stay the whole time, participate in discussion that we have, and having cameras on so that we know you're there. We'll also need you to complete a course evaluation to get that CE credit. And so I'll drop a link to a very short Google survey in the chat at the end of our session. And if you give us some feedback, you'll be able to let us know that you're seeking that credit, and we'll be able to get you a certificate in under 2 weeks. We are going to email copies of the slides and other materials after the training. So don't feel like you need to like screenshot everything. Like you're going to get copies of the slides as well as a copy of the recording, I think, via Victoria as time goes on. A quick note on accommodations. We did ask for accommodation. We put out a request for accommodation needs in the Zoom registration form. And so we've attempted to meet any of those needs that have arisen. And in that vein, we have closed captioning available. And I'm going to make sure it's on for me as well. And you can click the show captions button to enable that auto transcript. We're also going to attempt to read questions and comments aloud that are occurring in the chat so we can kind of keep people all on the same page and facilitate your learning. We've attempted to provide high contrast text and backgrounds. Hopefully it's visually accessible for folks. And if there's any other need that you can think of as we go through, just inviting you to privately message one of us, and we'll see what we can do to help you meet that need as we go. All right, jumping in. Here is our agenda. Here's what we're going to cover. We're going to talk about the secret ingredient of change. What does it take to help somebody make a change in their life? Um, and we'll talk about a variety of changes. For us in the kind of homelessness um, industry, I guess you could call it, sometimes it's as simple as, hey, do you want to come inside? What would it look like to come inside? Um, hey, you can't have 15 people staying in your apartment that you just got. What would it look like to not have that happen so we can make sure that you stay in this apartment, right? So various types of changes. And of course, it's really no secret. It's motivation. We need to be motivated to change. We'll talk about the spirit of motivational interviewing, and there are some key principles that MI hangs its hat on, and we'll try and invite you to include those principles in all your work and all your conversations with folks. We'll talk about some of the core skills and processes, or what they now call tasks of MI. We will talk a little bit about the stages of change model. It'll be brief. I do want to say that most people, when they think of motivational interviewing, also think of the stages of change, but wanting to kind of share outright that the stages of change, the trans theoretical model, is actually a different and separate model, right? That pairs really well with motivational interviewing, but it's not part of motivational interviewing itself. And so we want to talk about the ways that they overlap. We are going to spend a little time test driving some of our skills today. And so if you're like me, um, and you hear the word breakout group, your eyes might get wide and you get nervous, but I promise this will be fun and engaging. So don't worry. And then we'll do some Q&A. Our learning objectives for this session. We want you by the end to be able to articulate the role of motivational interviewing and participant-centered care. We want you really specifically to define and understand the components of ambivalence toward change. And we want you to be able to explain the ORS method of motivational interviewing. All right, I am going to kick it to Khalil to take us through this first little part here.
Great. So, some of these examples we're about to put on our screen might actually be real life lived examples of the folks that you work with, maybe even you in your life. But some of the assumptions that we make is that if you have a heart attack, right, we might make some modification or adjustments to our life so that we're not having a heart attack again, right? We might quit smoking, we might change the way we're eating. Um, if we lose a lot of money, we might seek some support if we lost that money via a gambling issue, right? I laugh because my like office, like right out of the window, you can see Rivers Casino, like in Philadelphia. So that is a funny example to me. But oh, and I don't go there. But anyway, if you're in a serious car accident, you might decide you don't want to drink and drive anymore. Um, this is one that we've seen a lot at Pathways, right? Threats of amputation, blindness, uh, some really intense infections because of specific substance use behaviors, right? We might think that somebody might change the way they're using, seek medical care, or manage whatever health conditions they have going on, maybe diabetes, right? And yet we know our folks don't do it. We know that we don't always make this decision all the time. One of the things that I think we appreciate doing in these trainings, and Ryan said, we like to poke at the audience a little bit, get folks engaged. But I think anytime we have an opportunity to reduce the distance between us and the folks that we serve, right? The people in your agency, is always movement toward trauma-informed care, right? And another buzzword in the helping profession. So one of the things we like to do is to think about ourselves in these situations, right? So if folks in this space could just think to yourself about something that you maybe want to change in your life, something maybe you really need to change in your life because you've gotten repeated feedback, right? Or maybe a health scare, or just something you've been thinking about changing for a while because you know your life will be better for it in some way. Um, but ideally something you haven't changed, right? And I'm wondering what folks think that missing ingredient might be. Why don't we make these changes that we want, need, or have really been thinking about changing in our lives? You can feel free to go ahead and unmute if you like. It looks like a smaller group, or fire something off in the chat.
Yeah, I would love to know if folks are feeling brave. Like what's the change that you've been pondering for like 6 months, a year, 4 years, right?
Yeah.
But still haven't done it. And like, why?
I can start if that's helpful. This won't be new to Ryan, but when I was working with Ryan every single day in the same office space, right? Um, I decided to get a really fancy gym membership, and the way I rationalized it was I wasn't going to get Dunkin' Donuts anymore, right? I'm not going to go to Dunkin' Donuts, not going to drink this coffee anymore, and that's how I'm going to pay for this gym membership because they were about the same. The amount I was spending in Dunkin' in a month was about the same as this gym membership. But here I am almost 2 years later, right? And it's here's my Dunkin', right? It's something I still do, has been really hard to give up. Um, that's an example for me, and I see some others in the chat. Self-care looks like a common theme here. I see a couple folks saying that it's definitely difficult to uh, get on our self-care wagon and then not fall off again or not need to fall off to like pay bills, survive, work, learn. Eating less sugar, that sounds like a health one from Patsy. Um, some health goals. And here's what we're fishing for, right? What is making it hard? Don't want to step outside of what's comfortable or easy. Um, Fear makes it difficult. Fear of what? Ryan asking all the great questions. Um, Allocating time for the gym I'm already paying for. I hear that. And I'm wondering what is keeping you from allocating that time? There's one buzzword we're trying to find here. Self-care, eat better, take time for self. What makes it hard? There aren't enough hours in a day. Yeah, there are some really like tangible, like practical reasons we can't engage in some changes in our lives. But I think if you think about the examples on the last slide, when it comes to like really significant health scares or like life changes where we are feeling like we maybe need to do something a little more big, right? Um, the missing piece might be motivation. Yay! Wait, somebody just put that in the chat. Same time. Love that. So motivation might be that missing ingredient, right? Um, so I'm wondering if the group has any kind of working definitions of motivation. What is it? What is motivation to the group of folks we are talking with today?
I love this idea of like the time management as being like the barrier for a change issue because for me it really fits well into my mental model of my working definition of motivation around like um, having a priority, like a clear priority, and being able to evaluate like, okay, how am I spending my time? I spend a lot of time doing this stuff, but I really want to do this thing. Which thing is actually my priority? And I think if we can get into this habit space of like, oh, I've been spending my time in this way, even though I really want this other thing, I'm not motivated enough for some reason to sort of like recalculate my time management. So I think that's part of it for me is like a prioritization factor.
Alex said, willingness to change, ready, willing, and able. There's a specific kind of like harm reduction tool that we use called the readiness ruler that I think measures each of these items also. And I think we'll talk about that toward the end of the training or like midway through. Um, Sorry, I'm finding my notes here. So yeah, this is great feedback, good definitions. The definition that we're going to work with in the training is the combination of belief that the pros outweigh the cons, and that you are able to make the change, right? That is that confidence piece. So is this going to benefit me? And do I have the confidence and the ability to know I can do this? One of the things that you might hear in the helping profession, right? When folks are kind of really burnt out or frustrated with clients or participants is that like I can't help this person because they don't want to help themselves, or I can't do more work than the client, right? But I'm also wondering if that is like a theme and a message that our participants have heard like echoed throughout their entire life, right? And if it's believing that they're like worthy of change and growth, right? To bolster that confidence and maybe increase that motivation piece that they can recover, that they can grow, that they can, live a fulfilling life, whatever that looks like to them. Alrighty, go for it, Ryan. I think.
Yep, here we go. Sorry. All right, let's do a little bit more engagement here. I want to ask you some true false questions. And so get your letter T on your keyboard ready or your letter F on your keyboard. And I'm going to make a statement. And I'd like just to kind of everybody to chime in. Do you think that statement is true or do you think it's false? And I'm going to try and corner you and trick you and all that kind of fun stuff. So some beliefs about motivation. Until a client is motivated to change, there's not much we can do. What are your thoughts on that? True or false? A lot of falses I'm seeing. Boom, 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 boom. No falses. I do like to hold out for like the contrarian person who's like, actually, I think that is true. Because I think that's fun conversation, but I'm not seeing any truths. Oh, there it is. Yes. There's a couple truths. For the true folks, please, since so every like a lot of other people are marking false, tell me why. Why true? Why is it true that there's not much we can do unless a client is motivated for change? And I'm sorry to put you on the spot, but I love to kind of have this. I love to kind of pit the truths and falses against one another and kind of pick that apart a little bit. Okay. So I see the statement that you won't see it until you see it. Okay. So, and I think you mean like the client is not going to see the kind of reality of change until something clicks for them, right? Sometimes I hear that as like, maybe this is what you're thinking too, like this idea that like there has to be a rock bottom and then things kind of click into place for people. Oh, I'm getting good compliments on my mind reading. I love it. Um, and then another comment here, because the client is the one to make their own changes and see the benefit. Okay, so I hear you. So like your idea is that like it's theirs, they own the change process in themselves. We can't like be the change for other people and meeting them where they're at. Okay, I'm hearing you. So for me, I mark this as false. And I think the spirit of motivational interviewing kind of thinks of this as a false statement. But here's the reason. Motivation is like an accessible thing that can be modified and enhanced. Yes, we can't make the change for somebody. And yes, they do have to be ready for their own changes, but we can help lay the groundwork for change, right? By tapping into their motivation, right? We can access and enhance somebody's motivation to change well before all of this stuff that I think we think has to happen before somebody hits rock bottom, right? People do a lot of damage in their health, their relationships, their reputation, their self-image if we take a very hands-off approach and say, well, they're going to get there when they're going to get there, right? And so I want to encourage us to think that yes, this person seems to not be that motivated towards change right now, but that doesn't mean I get to sort of lay back and just wait for them, right? There is work that I have to do. And so, yeah, we can't give it to them, but we can promote it, as Kalo says in the chat. Um, all right. My Zoom hand raises itself when I start gesticulating wildly. Here we go. Here's the second comment. Mark a true or false. It usually takes a significant crisis, aka hitting bottom, to motivate a person to change. What are your thoughts on that? True or false? All right, I'm seeing a lot of falses again. A lot of falses. I tend to find that people answer this with truths a lot, and you're not. And so I'm curious to know. Tell me why. Why would you think this is false? Um, why is it not true that it usually takes hitting bottom for a person to make a change? Heather says usually would be a true. Okay. So it's that like usually piece of it that comes in. Um, Victoria says false, but it can frequently be true. Yeah, I think this is where I'm at too. I'm kind of trying to play with words here a little bit, right? I bet everybody in this room, if you've done direct care with folks, um, has seen somebody reach a breaking point and come back to you and say, that was my bottom and I've made a change. I'm ready to make a change now. Or like, I can't keep living like this. And then when we look back on it, we say, wow, you really hit bottom there. And I'm so glad you're like working your way out of it and I'm ready to support you, right? Um, Sometimes this is how it happens, but clients don't have to hit rock bottom to make a change or to make a different decision in their lives, right? And I think the other thing that's really critical here is, from my perspective, this idea of hitting bottom is a retrospective idea. We don't know that we've hit bottom until we're like looking in the rearview mirror and saying, wow, that was my bottom, right? And so I think sometimes if we're not careful as providers, we can wait for people to hit rock bottom. And all that's happening is people are doing a lot of harm to themselves, suffering a lot of damage, experiencing incredible social stigma and health damage and stuff like that. And we're two hands off, right? Because we're like, well, they're going to hit bottom at some point. They'll come around. And this is the invitation to say, we don't have to wait for bottom. And in fact, this person may never hit bottom, and we can still do some work to help motivate them towards change. Um, Yeah, I see Sarah's comment that says, I work in a pediatric clinic setting, and oftentimes we see people before problems are big and provide therapy services as an intervention before there's a rock bottom, right? This idea of prevention. And I think that goes true for every single possible change. Victoria noting that like positive things can encourage positive changes, right? It's not always these negative, harmful things that like sometimes you can't come back from the brink of some of these things. I think about the folks walking around in Kensington, Philadelphia, who are opiate injection drug users. They're losing limbs, right? Almost dying. Sometimes they are dying as a result of incredibly significant infections and all the stigma around like, I can't even go to the doctor. They're not going to treat me like a person. I'm just figuring it out here on the street, right? That doesn't have to happen that way. Janine also kind of commenting that rock bottom can be different from person to person. And for that reason, it's hard for us to see and identify. I'm like waiting for you to hit my definition of rock bottom, but that's not going to be it for you, right? Okay, I'm going a little slow. Let me speed up the pace. Question. Motivation is influenced by human connections. True or false? A lot of trues I'm seeing. Yeah. I see a very true, a sometimes true. I love the variation here. I also love the folks that refuse to be cornered into the binary of true and false. I really appreciate that. Not always. Yeah. Motivational interviewing says absolutely. Motivation belongs to the person. We've been kind of touching on that already, but it results from the interactions between the individual as well as other people and the environment, right? And so we know that people's readiness for change is going to fluctuate over time, and we can influence it by being a support person in their life, right? Um, it's not some static personal attribute. My motivation equals 79% all the time. That's not the way motivation works. It goes up and down based on we're having good days or bad days, or are my bills paid and am I fed, or do I have people who are showing me care and affection? All of these things influence motivation. Um, yeah, I hear you, Tony. Tony says the wording of it is ambiguous. Um, Maybe a better way of saying it would be like motivation is typically influenced by human connections, sometimes influenced, can be influenced. Yeah, that's a good way of saying it. Okay, here's my next one. True or false? Readiness for change involves evaluating pros and cons. Is that true or false? Seeing a good number of truths so far. Oh, I see a false. I love it. Couple falses. So for the false folks, would love to hear some rationale. What are you thinking here? Why is it false that readiness for change involves evaluating pros and cons? Ooh, not everybody thinks that way. You're kind of seeing this as like a cognitive construct, and that thinking fits some people, but not everybody. You can be ready for change without doing the legwork or the research. Yeah, I think maybe this question hinges on this idea that like I have enough information to evaluate the pros and cons. yes, my liver is like in really bad shape, but I don't know what that means. I don't know what my numbers are, and I don't know what effects that's having on my body. Do I need all of that, or can I just say, "Ooh, I don't feel good when I drink too much. Maybe I should do something different," right? So I think it's good rationale there. I appreciate you hearing you say that. Depends on the person and their unique situation and past experiences. Yeah. Um, I think so. I'm trying to channel motivational interviewing, although I recognize your responses as like really valid and they make a lot of sense to me and they're logical. From the perspective of motivational interviewing, would say that this is a true statement. If what we're talking about is change is hard and we're ambivalent about making changes sometimes. And the way to resolve that ambivalence is to understand the pros and the cons. Now, I do think some people evaluate pros and cons in a very like gut check sort of way. Like, I don't think people are out here making lists of like, should I get sober? Or like, should I keep shooting dope? Ooh, there's like 6 on the sober side and only 5 on the shoot dope side. Maybe I should get sober. Like, I don't think that's actually happening for people. But I do think people are like taking stock of their situation in a very gut check, instinctual way and saying, like, this is not worth it anymore for me. And so from that perspective, I would still call that evaluating pros and cons. And yes, I love that you made this point. Heather says we can help guide this type of self-eval, and that is the role of motivational interviewing, is to like bring the pros and cons conversation to the table if folks aren't already doing it themselves. So that's great, Heather. Thanks for adding that. Okay, my next one. Creating motivation for change usually requires confrontation. True or false? It usually requires confrontation. I think of this in the kind of like tough love, real talk type of headspace. Or like if you've ever watched the show Intervention, it's like it's an A&E like reality show where the family like gets together and they like spring it on a person who's using drugs or alcohol or whatever. This is an intervention. Gotcha. We want you to go to treatment. Okay. I'm seeing a lot of falses. Sometimes, not always. Thanks. I appreciate that, Mary. Couple of trues. Motivational interviewing would say false to this one, in that confrontation can and often does promote resistance rather than a motivation to change or like cooperation, right? So we take a hardline stance on something and people put their defenses up and they say, no, like, don't talk to me that way. Or what often happens in the show Intervention is they say, okay, yeah, I'll go to that beautiful treatment facility in Florida. And then the next frame you see them like running away from the van or whatever. They're like hightailing it down the highway or whatever, right? Yeah, I'll do it, and then they're gone. Okay. This one is a tricky one. This one is a fun one. Resistance isn't a client problem. It's a therapist or staff member skill problem. What do you think about that? Whose issue is resistance? Is this question asking? Resistance isn't a client problem, it's an us problem. What do you think about that? Ah, my both and people out here defying the binary. T and F. It's both. Both. Everybody says both. Ooh, I like Mary's response. It's like a normal process. It's gonna happen. We got to deal with it. Both. False. Okay. From the perspective of motivational interviewing, I think we're on the same page, but I'm going to say true to this one, right? Denial, anger, resistance, these things are behaviors that are evoked by the relationship and by environmental conditions. They're not like traits of a person. And I think too often in my career, I've heard frustrated, vicariously traumatized staff say, that person is resistant. And I reject that frame. There is no such thing as a resistant person. There are people who sometimes are not vibing with what we're doing, and they put up their defenses, right? They argue, they interrupt us, they deny, they'll come, fall into denial or whatever. These things are not characteristics of that person. And so motivational interviewing says, um, rather than sort of seeing resistance as a client problem, see it as a behavior, a kind of a communication that what we're doing, saying, the way that we're interacting and trying to shape the motivation here is not working for this person. And we need to be doing something different. And so really, resistance is a good thing in that it's giving us a very clear message about what is working and what's not. I love this kind of example of um, a person who maybe is thinking about quitting smoking, but they go out and they take their smoke breaks outside of the office building, every so often. They're smoking and I go and take a walk, and every time I see that person smoking, I say, you should quit smoking. Hey, smoking is bad for you. Hey, did you know that like secondhand smoke is a key factor in cancer for people? I don't want to deal with that for, if every time I see this person smoking who's been thinking about quitting, I say to them, you should quit. Are they going to avoid smoking, or are they going to avoid me? Right? They don't want to they don't want to deal with me at all, right? And so I think that is a speaking to this a little bit, right? Our tact has to change when we face resistance. Okay. Um, want to kind of just share this comment here. I know we're not really like deep into motivational interviewing as a practice yet, kind of trying to lay the groundwork, but want to just share that motivational interviewing is a semi-directive. In other words, we are, it's not like person-centered therapy that is like non-directive at all, where we're not setting a direction. In motivational interviewing, we are setting some direction, but it's a counseling style. And the authors of motivational interviewing talk about the way that like you can use motivational interviewing with whatever other approach you're already doing, right? Like it may be possible to use motivational interviewing techniques when we're doing cognitive behavioral therapy, let's say, right? And so it's a counseling style. It's a way of being with people to try and resolve those motivational issues that are inhibiting positive change behavior. And so one of our main goals is always going to be to create or amplify the discrepancy between what's happening for a person right now and what they want in their life. You say you want this. Here's what's actually happening right now for you. Here's what you're doing. Help me understand that. Help me match those things up. And the idea is folks are going to be able to say to you what their own barriers are, what their own readiness, willingness, and ability to change is, right? When we people don't like to sit in that place of discrepancy. Ryan, you say you're about social justice, but you haven't been out on the streets protesting at all. Ooh, that doesn't feel good. Maybe I should stop saying I'm about social justice. Or maybe I should start like putting my money where my mouth is, right? Trying to resolve that discrepancy with people. I've also heard motivational interviewing called kindness with skill. And I love this idea of really prioritizing relationship, not outcome. I think if we're so focused on getting a person to do a specific change, we are missing it with people. And I think we're going to see so much more of that resistance, right? And so be in the process. It requires a great deal more patience, right? Be in the process with people without some expected ending. And sometimes we have to let people sit in some uncomfortable silence. You say you want this, but you're doing this. Help me understand. And let's just sit with that, right? Forgive me if I shared this quote during our Housing First training. It's one that I share in every training. It really hits for me. I'm sorry. I apologize to Khalil for hearing it in every single training that we do together. But it's this quote here. Healing is not a relationship between an expert and a problem. It's a relationship between human beings. And for me, this flies in the face of what I thought I was getting into when I got into social work years ago, right? You're being taught diagnostic criteria, and you're being taught case management skills, and you're being taught systems analysis, right? And so we walk away from this education thinking like, I'm an expert on these things, and I'm here to solve some problems for people. I want to help people. I want to solve their problems. But that's the wrong relationship. It's not me in touch with a problem trying to fix it. It's me in touch with a person and allowing that relationship to be the fertile ground for change for them. When people take change into their own hands with some support, they feel so much better about those changes and they want them more and they achieve them in ways that feel better, I think. Okay. Um, Talking a little bit about the spirit of MI, and here we're kind of directly from the MI kind of textbook, and it is a book. They just came out of their with their fourth edition of Motivational Interviewing, Miller and Rolnick, and they talk about these four kind of things that are present in motivational interviewing, the spirit that guides the practice. And by the way, motivational interviewing is super intensive about its acronyms. And so the acronym here is PACE. And it's partnership, which is that really active collaboration between us and the client. And when we're active in that partnership, they're going to be more willing to express concerns because we're showing empathy, genuine curiosity about their perspective. Hey, I think we could go this direction. What do you think? Oh, you want to go in a different direction. Got it. Tell me why. Tell me your perspective, right? We're inviting a collaboration rather than saying, "Hey, I'm a case manager. Here's what I've seen people do to be successful. Here's what you got to do to stay housed. Here's what you got to do to get and stay sober." The end, right? That's not a partnership. That's me being the expert, right? Um, in this partnership, though, we do have some influence, but the client should be guiding the conversation. The next one is acceptance. And this really refers to our respect for and approval of the client, the person, right? Doesn't mean we're going to agree with everything they say or do, but we are demonstrating to them an understanding of their point of view and their concerns. And so, how do we do that? How do we demonstrate acceptance that feels right for people? We're accepting of their worth, right? Prizing their inherent worth and potential as a human being. I think the housing first practice really emphasizes this as well. I think there's a lot of overlap here, but you are worth it as a person. You deserve to have your needs met and to feel well, right? There's also this component of accurate empathy. And motivational interviewing doesn't just talk about empathy, they always talk about accurate empathy, where we're kind of showing a very active interest in people's point of view and trying to understand them, um, always trying to get closer and closer to the client's truth, right? And that has to be guided by a very genuine curiosity. Like, I have to be a person that wants to know how this person ticks, and I have to get to the bottom of that in order to really understand their perspective and accept them as a person. We're also supporting people's autonomy and honoring and respecting their rights for self-direction. The third component, the third spirit is compassion. And I think this is easy for us as helpers, right? Like, I think this is like I don't know, it underlies everything that we do as helpers. It's why we're here, right? But it's like our very active promotion of their welfare, of our clients' welfare and prioritizing their needs. And I think this is one that people don't miss often, right? Like, I'm a case manager, I'm a therapist, I'm a helper. What do you need? Here are the resources that I have. How can I go above and beyond? This part comes easy for folks. The final one is evocation. And I think this one's critical in motivational interviewing. We're trying to elicit people's own motivations, elicit their values, elicit their strengths, evoke from them the resources that they already have and reasons for possible change. We're evoking at every step of the way, right? I don't want to be trying to implant motivation, desire, need in people. I want to evoke it from them. What's uncomfortable about your situation right now? Why is that so uncomfortable? What would it look like to not be living in that discomfort? How do we get there? It's all coming from the client, right? Okay, let me pause here because I've been talking for like a long time. Are there questions, comments, or concerns that are arising for folks? Is there anything that folks are wanting to dig into a little bit more before I keep it moving? Okay, just inviting you again. Stop me as we go, chat as we go, ask your questions. would rather do that than just like preach at you, although I can do it. All right. What is not motivational interviewing? And I mean to say that these things don't fit the motivational interviewing kind of ethic, but it doesn't mean there's no place for them in our work overall, right? I just want to say that if you're doing these things, it doesn't necessarily fit motivational interviewing. So, motivational interviewing does not include confrontation, right? Where we're trying to kind of like impose our reality that they can't see. Um, Come on, you've done this 3 times. Like, it has to stop here. We can't rehouse you. There are no more eviction processes we can go through. It ends here or we're done. That's not motivational interviewing. I don't mean to say that there's no place for that kind of conversation, but it's not MI. MI doesn't also doesn't include kind of as a baseline a component of education, where if I can just like get them to have the right knowledge or insight or skills, that change is going to automatically occur. Now, this one I caveat and say that MI does include some education, but only through this like consent-based process. There's a skill that I think we'll talk about a little later called ask, offer, ask. And it's this rhythm that we can get into with people where I'm saying, hey, have you heard anything about the effects of alcohol on the liver? No, I haven't. "Oh, would you mind if I shared a little bit about what I was learning recently when I talked to the doctor? Sure. Well, alcohol affects the liver this way, and if your liver levels get to this point, you'll start to have this medical effect, and blah 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 blah. Right? So I have offered some education, but only because I've asked. I've said, "Hey, is it an appropriate time for me to give some information?" And if it is, I'll give that information, and then I'll ask again. How did that sit with you? What do you make of that? What I just shared with you about the liver? Oh, I had never heard that before. That's kind of scary. What do people usually do? Oh, would you mind if I shared a little bit about some of the treatment strategies for these liver conditions? Sure. Oh, where there's a treatment center down the road, I can kind of engage in this boop de boop de boop, ask, offer, ask if I can share information. And if I get consent, I offer information. And then I ask again, how did that sit with you? Can I offer you some more information? So education is a part of MI, but only through a consent-based process. And then finally, MI is not about authority, where we're telling the client what to do. And in fact, it's all about reducing those hierarchies, flattening those power dynamics, and trying to be in partnership, as I said before. Okay, let me move us on. Carlo, you want to talk about ambivalence?
I guess so. Um, just kidding. I'd love to talk about ambivalence. So, I think ambivalence is a fun topic, is really a fun word because I think a lot of people maybe use it incorrectly, right? I think oftentimes when folks are saying somebody is ambivalent, what they are actually trying to say is this person doesn't care. This person doesn't seem like they care, right? Which isn't necessarily ambivalence. When I think about ambivalence, I think about stuckness. And that is because um, when we're talking about ambivalence, we're talking about a person feeling two ways about the same thing, right? I know I should do this, and here are the reasons I don't want to do it, or don't feel safe to do it, or don't feel like I can do it, right? And often it's not that people don't know how to change, right? It's that they feel that stuckness. They maybe know what would be healthier or movement in the right direction, or is the direction they might want to go, but there is something kind of holding them back, right? So if you think about our definition of motivation that we're talking about, right? Somebody has to have that confidence that the pros are going to outweigh the cons in moving through this decision, right? I work with a group of like graduate level social worker. They are going to graduate in December, and each class that we meet, somebody has to present a case presentation, and they love this word ambivalence, right? And that's one of the themes that I'm finding is like they feel like someone doesn't care, and they're substituting that word ambivalence when really the idea of like stuckness, I think, might be a better kind of synonym for that. Um, so one of the things Ryan talked again about, flattening the power dynamic. But if we think about our own lives, right, there are very few decisions that we probably make with 100% certainty, right? We might be on the edge of like, I know I need to do this thing, but I don't necessarily want to. I gave the gym example earlier. right? And I know some people are like, "Ooh, I love CrossFit," right? I hate the gym. I hate going. I don't like it. It's not enjoyable for me. Whatever. Something I need to work on probably with my own therapist, right? But I do know that it's a decision that will make me feel better if I do end up moving through that, right? Um, so one of the things we like to let folks know is that ambivalence is a normal part of the change process for everyone. So knowing that when someone's going to make a big or significant change in their life and that there will exist this period of stuckness for them, when we can expect that, we might be better equipped to support them um, through eventual maybe change or growth, right? So um, one of the things we might be able to highlight or pick out of the information a client is giving to us is change talk versus sustain talk. Um, so these are pretty easy kind of concepts to pick up on, but sustain talk are going to be statements that support not changing. I know I need to take my meds, but I hate going to the hospital, right? Or something similar. I know I need to go get this wound looked at, but I don't want to go to Temple Episcopal, right? Whatever it um, is going to be this. I'm sorry. That example gives sustain and change talk, but the sustain talk is what somebody is saying to kind of keep them where they are, right? Keep them from moving forward. It is basically their cons. Here's why I don't want to make this change. And change talk are going to be statements that point towards a willingness to change, right? Maybe that motivation piece is being hinted at a little bit, right? I really miss talking to my family, but I don't want to see X, Y, and Z next week. Um, the change talk there might be, I really want to see my family, right? Ryan, did you want to do some role play here, or is that
Sure, we can do that. We had envisioned this a frequent occurrence, a pathways where folks go into inpatient hospitalization and then they're discharged. And so I'll play the staff role and Khalil can play the client role, where I'm wanting to start a conversation with Khalil about maintaining his meds after he leaves the hospital. And so I might say to Khalil, hey, I know the psychiatrist put in an order for medication for you. What do you think about taking them?
I'll try, but I'm really not sure.
What are you thinking about it? Like what when you think about the medication, what thoughts come up for you?
I don't want to go back to the hospital and I hate taking my pills.
Yeah. So and you're hearing in that Halil's sustain talk there, right? The reasons why he doesn't want to make a change, even though he's already gone through this process of being inpatient hospitalized, right? And met with the psychiatrist and found a course of treatment that the psychiatrist thinks might be helpful. There are a bunch of reasons why he doesn't want to make a change, right? And so you're hearing his reasons, his sustain talk for not moving.
All right.
Wanted to also add in this bit here that sometimes we can argue with clients about that change and we can make matters worse, right? And so folks who are in this ambivalence state and they're doing sustained talk, we start pushing on the change talk side, right? And so Kyle, pick up the example again from there and I'll show you what it looks like to hammer the change talk too hard.
Sure. I don't want to go back to the hospital and I hate taking my pills.
But you really need to take your meds so you don't have to go back to the hospital. Like if you don't take these meds, you're going to end up back in the hospital, which is what you don't want. You do so much better when you're taking your meds. What did we notice there? Does that sound like a convincing argument for Khalil? To me, I don't think it's convincing at all, right? And I think one thing that we often see when we start pushing on one side of ambivalence is people defend the other side, right? And so this idea of resistance um, kind of rises to the surface even more. Like people are more resistant because we're pushing them. They're ambivalent and we're pushing them one way. They're like, no, no, no. There's this other side of the coin, and I want to let you know that by defending it, right? Heather, I apologize for it sounding generic. That is simply my script writing ability, not motivational
Yeah,
interviewing.
I was going to ask if it was the example or like Ryan's response. I think it might have been the response, Ryan. It looks like they're saying, not your writing. You can hear aggression in that argument. Yeah, the response. Um, yeah, of course. I do better when I'm taking my meds, right? I've maybe felt that in my brain, in my body at some point, right? But you're not listening to what I'm saying, right? And then I hate going back to the hospital. Um, Alrighty, so we will move it along. Yes, not a real connection. Thanks, Heather. If you think back to like Ryan's the quote they shared by Rachel Remen, right? The idea that healing is a relationship, right? Um, of course, you're going to tell me what you think I need to do, but I want you to see me as a person. Alrighty, so here is the next slide with some change and sustain talk examples. So change talk are going to be the statements that are made by the client that point towards that willingness to change, right? It's not important in the moment to be like, oh, it sounds like you're giving me some change talk right now, right? But it is important for you as like the provider or whoever you are in this person's life, to be able to notice those things, right? Because those are the statements that we're going to kind of cling to, right? And use to kind of bolster that confidence and that motivation that might be the missing piece here. There's another acronym here. You'll see it actually on this chart. The acronym is DARN CAT, DARNCAT. Um, and the D is going to stand for desire to change, right? So these are the statements um, about just wanting something different in our lives, or that a client wants different in their life, right? So a client might say pretty explicitly, right? I want to cut down on my drinking, right? What sustained talk might sound like in this kind of like desire space is, I love how drinking makes me feel. We might even hear these statements kind of coupled up, right? I I really love drinking, but I know I need to cut down on my drinking, right? The A stands for ability, somebody's ability to change. This is expressed in statements about self-perception of capability, right? So that confidence piece that we talked about. I could cut back to drink. I could cut back to one drink with dinner on weekends, right? If we work in abstinence-based settings, this may send off alarm bells, right? But if this is progress and growth for this person, we maybe want to hang on to that, right? If having one drink during dinner on the weekends is different than having 8 or 9 drinks a night through the weekend for this person, maybe that's something we want to be encouraging. Um, if somebody kind of is lacking confidence in their ability to make change, it might sound like, I can manage my life just fine without giving up alcohol, right? That to me, if I heard somebody say it, I'd be like, okay, this person either isn't ready or doesn't want to stop drinking, right? But also, if we're thinking about it through this ability lens, like I wonder if it's this person's confidence that they can give up alcohol. Um, R stands for reasons to change. So this is expressed as arguments for change, right? This is our kind of logical brain. I'll miss less time at work if I cut down. A lot of times in the substance use space, something I've found was really cool when working with parents or people who had goals to like reunite or like engage in some sort of like caregiving role in the lives of their children is writing out kind of like the cost of the substances that they were using, right? And not even all like illicit substances, even just cigarettes, right? For somebody, I'm working with a client right now who wants to reduce the amount of cigarettes that they're smoking, right? And just writing out how much money they're spending in a given amount of time and how much money could be going toward like other parts of their life, like I don't know, a gym membership. I'm just kidding. Or their child, for this example, right, is like whoa, that's a very practical reason for me to kind of change or curb this behavior. Um, N stands for need to change. This is expressing client statements about importance or urgency, right? This is probably after those significant like incidents or health scares that we might have that we talked about at the beginning of the training. I have to cut down. My doctor told me that the amount I'm drinking puts my health at risk. Sustained talk might sound like I need to get drunk to deal with the day to day. And again, this is sustained talk because this person is finding reasons to kind of stay where they are or not kind of move forward, especially if they're able to say, I have to cut down on my drinking. If there's the change talk, right? They want to do that, or they're expressing the need to do that in the next example. Uh, Commitment, this is expressed as a promise to change. I promise to cut back this weekend. Um, if someone is sharing that with you, I think the word is promise is a little bit strange in clinical settings, but if somebody is saying this to you, it sounds like they're really expressing. Uh, I think this goes back to the desire piece, the desire to not use or use less over the weekend. Um, and activation, this is expressed in statements showing movement toward action, right? This is we can see the change coming. I'm ready to do something about the drinking, right? That is change talk. We want to kind of um, poke at that a little more and see how we what we can do to be supporting our folks in um, if they're making statements that sound like activation and they're ready to go, right? And then taking steps. I only had one drink with dinner on Saturday, right? What are we going to say? What might it sound like to really kind of emphasize the change that that person is making, or like the progress that they're making. Sustained talk might sound like I'm still drinking every day, right? Um, yeah, that's what I've got here. Anything about darn cat, Ryan?
I just want to offer that, like, uh, I mentioned that motivational interviewing is like about acronyms. And so like darn cat is pretty important in us like understanding, okay, wait a minute, I'm hearing change talk or I'm hearing sustain talk, and what do I do with this, right? Sometimes we're hearing a combination of those, sometimes we're hearing one or the other. And for me, I think it's less important for you to be able to like categorize the change talk or sustain talk as like, ooh, I'm hearing a reasons change talk, or I'm hearing an ability sustain talk. That I think is less important rather than being able to sort of say, ooh, that's change talk. That's sustain talk. We want to be able to like categorize statements that we hear according to like where they fit on the ambivalence spectrum.
Mhm.
Okay, wait a minute. I'm hearing ambivalence. It's arising as change talk in this way, sustain talk in this way. When we can make that categorization, some of the future skills that we'll talk about in a little bit are going to make more sense, right? You're going to be able to say, okay, wait a minute. I need to emphasize the change talk that I'm hearing. Remember, we're not implanting reasons for people, but when they present some to us of their own cognition, we're saying, ooh, wow, that's an interesting one, right? Like, what a good reason for change, right? I'm emphasizing that to kind of build momentum in the direction of change. And so I mentioned motivational interviewing is semi-directive. I'm not just hearing change talk and sustain talk and saying, wow, cool. What do you want to do? Right? It's like, oh, wow, cool. That's a cool reason for change. What's next? Right? We'll
Yeah.
go ahead, follow.
Um, I actually, there is a therapy modality I really appreciate in the therapy space called acceptance and commitment therapy, and it sounds really fluffy, and it is, uh, but it really kind of focuses on, now that I'm thinking about it, the idea of sustained talk. When somebody comes into my space and is saying, I want to make this change, right? Or they're saying, this thing is really kind of impacting my life in a big way. And maybe that's drinking. If you look at this reasons kind of line here in Darn Cat, right? If they're coming to me and saying, here are all these really intense moments in my life I've had as a result of alcohol. And then they're also telling me getting drunk helps me, who wrote this? Getting drunk helps me feel unwind. Getting drunk getting drunk helps me unwind. Something I might ask is, does it, based on what they're telling me, right? If they've had all these kind of catastrophes in their life because of drinking, I might ask, like, is drinking helping you unwind? um to kind of uh and I think that's one way we can not argue, right, and not necessarily be like conflictually confrontational, but really kind of noticing the sustained talk and getting somebody to explore that a little further. It's like, is this actually doing what you want it to be doing, or what you're saying it is going to do, or will do for you? Uh,
Yeah, I like this idea that like people do get stuck kind of repeating their sustained talk scripts out loud, right? Like I've been saying that it helps me unwind for like 15 years now, but like I'm still drinking very heavily and it's getting worse, and like my relationships are falling apart and I don't have a job. Is it helping me unwind still? Or
mhm.
is it fulfilling other needs? Or like is that, if have I not like reevaluated that sustained talk and maybe I need
Yeah. hmm If we take so substances aside, if somebody is experiencing some pretty intense depression, right, and their go-to is to isolate, right, maybe like lock themselves in their rooms and shut people out, um, is this making us feel better, right? Like, is this helping? Um, might be another kind of sustain versus change talk kind of example there, or like space to explore. Like, are these behaviors, are these things that you're doing or sharing actually helpful for you in your life and like toward where you want to go? Um, Alrighty. So we have the fixing reflex. So when I was a kiddo, I was really obsessed with animal pain, and every time I see this slide, I think about it. But this little visual of the cat over here is a real life thing, right? And I think it's where the idea of like cats always landing on their feet comes from. Um, Cats have a fixing reflex. I think it's called like a righting reflex actually in their bodies that will just like curve their spine to land on their feet when they're falling, right? Um, and it's not above us to want to do the same thing when we're helping professionals, right? We definitely have that urge to fix or to tell clients what they should or need to be doing. So just piggybacking off of the idea of ambivalence, when dealing with ambivalence, it's ineffective to ask, why don't you want to change? Why don't you just sign up for treatment? Why do you think you aren't at risk? How can you tell me you don't have a problem? These are all also like statements that are just not very trauma informed. Um, and I think depending on like the context and like the relationship, but if our goal is motivational interviewing, right? I think these kind of statements might encourage client to lean more on that sustained talk. I don't want to change because X, Y, and Z, or I don't want to do this thing because there are too many barriers to treatment, or I'm not at risk because I'm still alive, right? Is what that sustained talk might sound like in this example. But I think it's important to know um, that we do this out of care and concern for our participants and the folks that we work with, right? But something I like to share is that our role is probably much more likely to support and not fix, right? And when I know my role is to support this client and not fix them, I feel like that makes all of our lives easier, right? That makes the client's life easier, and that makes my life easier. And that knowing this is a person who is going to make their own decisions, and I am supporting them in making hopefully decisions that they want to be making. Um, so another important thing to recognize is that I said that this impulse comes from care and concern, right? You are a helping professional, but it can also come out of just some anxiety and fear for the person's overall well-being. Um, but I think I'd also add that that's more about us, right? Alleviating our own worry, our own anxieties about this person and their care and the growth that they're going to make. Um, I also just like to ask folks, like as an adult, like when is the last time you made a decision for yourself that you didn't want to make, right? I can't think of the last time I did something that I didn't want to do. Um, Post college probably, right? But um when we try to tell people to change, or we're trying to really convince them or persuade them, this can create resistance, right? I think one of our true or false questions was about resistance. Is this a clinician problem, or is this a client issue? And I think there was a mixed bag of answers there, right? But if we're arguing for one side, for somebody who's already experiencing that stuckness, right, that ambivalence, an ambivalent person is likely to defend the other, right? We are increasing their movement toward and their inclusion of more and more sustained talk, right? So we might actually be contributing to that resistance in that specific scenario. Alrighty, so a little bit more about resistance. I think Ryan earlier shared that resistance might actually be defensiveness, right? If we're arguing with clients and trying to talk them into treatment or into specific decisions that we think are best for them, right? They might actually just be defensive, right? So one of the things we like to share is that resistance is the same thing as sustained talk, right? Arguing against change. Um, so resistance is a normal part of ambivalence. but is also an opportunity, right? What me, um, sorry. And I think what we mean by resistance is an opportunity is to think about those things that we were sharing earlier and like really exploring and poking at like, is this the decision you want to make for yourself? Or like, does this sound like the healthiest option for you? Based on like your goals here, or like what you've told me last week is what I think that might look like. Our goal isn't always to ignore sustained talk, right? We probably want to really hook on to and emphasize that change talk, but sustained talk might be worth addressing as well in this kind of like opportunity space. Um, we want to respond in novel and non-confrontational in a non-confrontational manner. We want folks to keep talking to us, right? Um, we have just four types of resistance here. These are all probably things you've seen with folks that you've worked with. Um, so when folks are arguing, that might be another sign that folks are defensive, right? Maybe they're feeling threatened. Um, I think when clients are interrupting us, they're likely probably feeling misunderstood, right? We probably need to take a step back and hear what they're saying there. If someone's very noticeably just not listening, right? Looking at the clock or talking about a different topic, they right, that's probably not the best time to be engaging in any sort of um uh like actual like work, I think. We want to be responding with reflections that feel and sound affirming, and refocusing, kind of using our motivational interviewing tools that we'll talk about some more. And I actually think we'll have an additional slide on like what is an affirmation? What does that sound like and look like? So I'll table that for then. But I think that this is a helpful visual to be thinking about when we have motivational interviewing in mind, right? Sometimes this image on the left, right, is really what we're doing with our participants, right? We are like wrestling, we are in constant kind of like battle and confrontation, trying to like influence specific change or decisions, right? But if we move more toward the idea of like collaboration and some mutual decision making, it's more like a dance, right? This is teamwork, I think, is the goal of motivational interviewing. Is how can I take what you're saying and help support you with what it sounds like you already know about yourself? Um, so the idea of dancing, right, instead of wrestling and kind of fighting and combating our clients, I think is a fun way to be thinking about this.
I think rather than hop right into the four tasks of MI, I think that was a good time for a quick break. So let's take 4 or 5 minutes, come back at let's call it 15 past the hour, and we'll dive into the rest of it. So fill up your coffee, your water, or whatever, and we'll jump in fresh. All right. So what you see on the slide here is how motivational interviewing um, sees the kind of process unfolding of the change. Importantly, and it's hard to kind of talk about this in a way that is nonlinear, but these tasks that you see on the screen are expected to be somewhat fluid, right? Not a linear process. Can people can kind of the collaboration can move between these different tasks. And if you're familiar with the stages of change, we'll go over those in a little bit more detail later, but um, similarly, people can, be in the action phase of change and then pop back down to contemplation, right? And so pop around quite a bit. So these four tasks, this was previously called the four processes of MI. In the latest edition of motivational interviewing, they've called them the four tasks, things that we should be doing as providers. So the first task is engaging. And it's that simple process of establishing this like mutual trust and that respectful helping relationship. Here, I'm here to support you. I'm here to kind of bring my compassion and acceptance and partnership to the table. We are focusing on, what are the strengths that the person in front of us is kind of coming to the table with. We'll use the ORS skills, which we'll talk about just on the very next slide, but to kind of determine folks' readiness for change at this stage, right? The task is building that relationship, figuring out how ready they are for change. What are we even talking about here? But we're not really taking action. And I think it's really important to say this piece, right? Like go slow to go fast is always my motto with kind of relational therapeutic change. I think I'll speak for myself. Earlier in my career, I wanted to get to the brass tacks of like, what are we doing? Let's make the goal plan. Like, let's take some steps. Let's take some action steps, and have sometimes shortchanged the relational engagement process. And I've had to kind of go back and say, wait a minute, we need to build more trust here because like this person is ignoring everything I say, or like they tell me they're going to come to the appointments and they never do. They tell me they're going to take these steps and they never do. Something is wrong here in me, right? And in the way that I'm choosing to engage. The next task is focusing. And so this is where we try and find a direction for our conversation and our process, right? Like a mutually agreed upon agenda. Here's what we're here to do together. But that can't happen until we've done this work of engagement. Um, we're naming what's important to the client and we're setting goals based on those things. Either what's important in terms of like how you envision your life or what's important to you in terms of your values, um, evoking all of this in the focusing process. Um, you know, and as we start to develop kind of a shared understanding of the general direction, then we can narrow the focus to like a specific behavior, right? So it's not what specific behavior do you want to change? Is it reducing your drinking? It's what would you want your life to look like? Oh, you want to have your own apartment and you want to be able to see your kids and you want to have friends over, and then we can start to target down, oh, wait a minute, your drinking is getting in the way. Maybe that's one specific behavior we can discuss in more depth in the direction of that larger change that you want to make. The next task is evoking. And of course, this is a core part of MI. We're evoking that change talk that we um, hammered home quite a bit earlier. We're responding to sustain and change talk with active reflection, right? Kind of giving it back to folks, checking in on our understanding. Are we on the same page? Is this what you're saying? Um, we're starting to work towards developing discrepancy between what you said you wanted and what you're actually doing, right? Um, and hopefully we're evoking some hope and some confidence at this stage that like, I think you can do this. What would it take? What do you need? Like, what tools do you need? And then finally is the planning task where we're helping clients develop a change plan that's actually like realistic and acceptable to them. I have so many times developed change plans like for people that they simply like toss right out the window, right? Like they're not interested in my change plan for them. They're interested in like developing something that feels realistic. Thinking even about like safety plans and crisis planning. Okay, what's one behavior that you're going to do to kind of keep yourself well when your mood spikes, right? What about deep breaths? We've been practicing deep breaths. Okay, but they're like not that into the deep breaths. Well, they're never going to do it, right? And so it really has to come from the person in terms of this planning phase. Um, we're paying attention to their change talk. We're confirming, wait a minute, we're still on the same page with the goal that you want. We're getting their ideas for how to make the change. We're exploring the pros and cons of direction. And hopefully we can offer a menu of options to help people make the change that they want to make. All right, here are the core skills of one set of core skills of motivational interviewing. Just to check in to make sure you're still awake. Are you still with me? Are you still here? Give me like a little zoom hand or a thumbs up or a reaction of some kind, and let me know if you are familiar with the core skills of MI ORS. Tell me who is familiar with ORS by reacting in some way. Wait a minute, I've been muted. How long have I been muted? Or
We can hear you.
okay, good. ORS stands for open-ended questions, affirmation, reflective listening, and summarizing. I will say my spouse is a therapist, and sometimes if I start using ORS in like our day-to-day conversations, that gets called out. Like, don't talk to me that way. I'm not a client or whatever. But I use these strategies in my personal life. I think it's a cute little map for how to talk to people and how to listen well to people. And so let's go through each of these. It starts with open-ended questions. I'm sure that you're very familiar with what an open-ended question is, but essentially, it's any question that doesn't arrive at like a yes or no answer or like a closed response, right? Because what we're trying to do is we're trying to invite people to tell us their story. And why? Because we're trying to evoke their own motivation that exists already in their lives. Where are you experiencing discomfort? What's it like to experience X, Y, and Z? What would it look like to imagine some other future? If you do imagine it, what does it look like? So we're kind of offering this always, always, always this invitation to say more. We're creating space for people to elaborate, to give us detail about their lives and their experiences, their values, their goals. What relationships are important to them, what outcomes are important to them. We can only get there through open-ended questions. And our responses to their responses can be more open-ended questions, right? Hey, tell me a little bit more about that. Hey, you said it was like so painful to experience this. What did that feel like? Did where do you feel that? Is that in your body? Is it a psychological thing? Tell me more about that. We're just opening the door over and over and over again. Here are some examples of open-ended questions. What are some reasons you may want to see the psychiatrist? Right? We've been talking about your mental health a lot. What are some reasons why it might be beneficial to see a psychiatrist? Can you think of any? Right? What are your thoughts on moving into an apartment? I think sometimes we come from this assumption that like these things that we have to offer people are good in and of themselves, right? And I think we approach these questions as if the things that we have to offer are value neutral. Moving into an apartment seems great to me, and I want it for you too, but I'm not sure that you feel that way. And so I want to get to the bottom of that first, right? Tell me what challenges you encountered when you ended up homeless. Tell me what it's like to live on the streets. These are open-ended questions inviting people to tell their story. And if you hear that it's really great and fine and dandy, your next question can't be, do you want to move in to an apartment? Right? Like that doesn't make sense. It doesn't align with what they're thinking in terms of their values and their goals. The next one is affirmation, affirming. This one's for you, Kalo. Let us know what you think about affirming.
Alrighty. So, sorry, I have my notes on another screen. But affirming is going to be highlighting clients' strengths so that we're able to build confidence, right? Thinking back against that motivation definition here. Um, Affirmations promote self-efficacy and can lead to action. And it might sound like you took a big step in coming in here today, right? Um, One of the things we like to make clear though is that being affirming is not necessarily praise, right? Um, it's about noticing and reflecting back the client's specific qualities and accomplishments. So what I like to say about this one is in thinking about my own life, I remember some really meaningful kind of feedback, support, maybe compliments that I've received in my life, and none of them sound like good job or I'm proud of you, right? So affirmations are taking it maybe one step further and a little more specific, right? So the other example on the screen so far says that's a good idea for how you can avoid situations where you might be tempted to drink. Um, you are very resourceful. I think a lot of the folks that we work with in our space are super resourceful. And in spite of these setbacks, you keep trying to quit using. So again, affirmation is a little bit different than praise because it's going to emphasize client strengths and past successes. Um, and we really want to focus on the you statements instead of the I statements, right? What is this client doing that we can kind of pull out and show to them, right? Um, I can really tell you've been making really intentional efforts to um, come to the office more often in the past couple months. I can tell you really want to make this change in your life. Um, yeah, I don't think we need to role play this one, but that is what it looks like to affirm somebody. And again, I think promoting self-efficacy is going to be important here, right? This isn't me doing this for you, right? This is you doing it for you.
Can I
Um,
add to that? Another place where we might want to affirm will be when we hear change talk, right? Like I'm identifying a reason for change or the ability for change, and the worker across from me can sort of emphasize that by offering an affirmation related to that decision point or that like mental energy. And in that way, again, I think of motivational interviewing as like this avalanching towards change where we can build momentum. And one way that we can build momentum towards change is by affirming every change statement that they make, or maybe not literally everyone, but like in general, affirming when we hear change talk.
Yeah, and I think oftentimes like our participants, the efforts that they do make, even if they're such a small, like do go unnoticed. So I think even just letting somebody know like you see them trying, right, can really make a significant difference in maybe the motivation or even just like the seen-ness of our clients. All right, reflective listening. Another one that's really easy to practice just in your day to day, in your car, on your way to work, in the shower, in your bathroom mirror. But this is going to be the real-time proof that a client is being heard. So there are varying levels of reflection in the reflective listening space. So we're going to go through a little bit more examples here. Um, but again, these things take practice and don't always come very easy. Um, Actually, one of them, I'll tell you a story about one where I've struggled with to understand. And I used to get into this training every time and be like, Ryan, what does this mean? And have to be told each time because I didn't understand one. Now I understand it, and I have a fun example for you as well. Um, so reflective listening is going to be going to be used to make a hypothesis about their meaning and reflect back your best guess. Um, So this could look really simple, like repeating or paraphrasing what somebody is sharing with us. And then it can also be a little more complex, emphasize or pull out the feeling or meaning of what somebody is saying. Um, or it can be amplified. And that's the example I have for my own life. But um, I think when it comes to reflective listening, it is also kind of reaching out to clients to ask like if your interpretation of like what they're sharing with you is correct and gives them the ability to kind of come back and say, actually, no, it's not. And then we're learning about the client from there, right? And more about the relationship. So if someone is saying, my wife is nagging me about drinking, reflective feedback might sound like your wife's pressuring you about your drinking. And this is probably that simple kind of reflection, right? This is either like repeating or paraphrasing what the client has just shared with us. This was the one that I used to really struggle with, the idea of an amplified kind of reflection, right? I think my cocaine use is just not a problem for me. Amplifying this might be like kind of aligning with our clients and saying what they're saying in a way that is a little emphasized or exaggerated, right? There are absolutely no negative consequences of using cocaine. This is a little trickery, right? Like a client might actually move away from sustained talk and be like, no, of course cocaine has negative consequences, right? In this example. An example of this in my own life is so Ryan talked about their partner. I feel pretty safe talking about mine, but my partner really struggles with road rage. Nothing dangerous, like they don't like we're off the road or anything, but they yell and they cuss sometimes, right? And I've started saying, yeah, that person must really hate you. And my partner just looks at me like, what? Like, what are you doing? I'm like, yeah, I feel like they probably just hate you. That's why they're doing that. Um, and it becomes a little more humorous and fun, right? But my goal in that, thanks, Heather, I appreciate that. But my goal there is to like let my client know like this really isn't that deep, right? This person has no skin in the game and you know the outcome of your life and what's going on, and they probably don't even care, right? That's how I use amplification in my own life when it comes to reflective listening. Is taking that really kind of amped up energy and aligning myself with my partner. Um, But we can also do this with our clients too in this statement that's right here, right? And our client might come back with like, wait, there are negative uses of my cocaine use, and that's why I'm here, right? Um, Next slide. So here are some examples of what it looks like to not be a reflective listener, right? So when we're ordering or directing, uh, warning or moralizing, giving advice or solutions, judging, shaming, approving, and praising. Now, some of these have space in kind of other modalities and in context, but are not motivational interviewing. So like sometimes it is our role to give advice, right? And Ryan talked earlier about just asking, right? Ask, offer, ask, and that might be a good. We can either ask to give advice, or a client might come in here and say, "What do I do about this?" Right? And they might be actually soliciting feedback from you and really want and appreciate that. And that is also another sign where we might be able to lean into some more direct like advice giving.
The final component of ORS is summarizing, and this is a type of reflective listening when we summarize, but we use it at a specific point in our conversations with people. I'm sure you're familiar with this idea that, like, you're having an in-depth conversation with somebody. Maybe even think about your personal life, not just like client work. And you're like really getting into a topic. And like eventually that topic reaches an endpoint, and you can almost feel it in your body, or at least I can, that like, ooh, we're like arriving at the end of this topic. Do I jump into the next topic? Do I say goodbye? Like what do I do? There's like an energy that needs to sort of move when we reach the end of a talking point. And so that's a transition point that summarizing is really built for. And what we're trying to do when we offer a larger summary is we're trying to paint maybe a fuller picture than we do with like one-off reflective listening statements, right? When we're reflectively listening, we're kind of very much in the moment, not looking at the larger picture necessarily. Summarizing, we're really looking at the larger picture of our whole conversation. And what we want to do is reinforce all the change talk that we heard, right? Because what do human beings do when they have a conversation? They kind of reflect on all the stuff that gets emphasized, right? When you're thinking about the conversation that we had earlier, you're going to think about all the emphasis points. Those are going to be the headlines in your memory, right? And so it's a kind of a three-part formula for a summary. We want to begin with a statement that indicates, like, hey, I'm getting ready to make a summary. And so we do that by saying something like, let me see if I have all this, right? Let me see if I understand so far. Let me like put it all together, right? And let's see if we're on the same page. So I'll make that intro statement. Then I'll do some of those same reflective listening strategies that Khalil kind of took us through, but I'm going to really emphasize all the change statements that I heard. And I'll ignore all the sustained statements that I heard, right? So this is why it's so important to be clear on, like, wait a minute, this is change talk, this is sustained talk. I'm hearing them and identifying them, and I'm going to push the change talk a little bit, or I'm going to amplify those ones, right? Um, I'll be concise. I'll reinforce all the change talk, and then I'm going to check in about my understanding. Did I miss anything that we talked about so far? Let me see if I understand so far. You're really thinking about making a change because you're wanting to avoid the conflict with your wife, and you've been calling out sick a lot from work on Mondays, and your doctor's been letting you know a little bit about your liver. Did I miss anything? No, that's it. You got it, right? Or sometimes what happens when we make one of these big, nice, crafted summaries, people are ready to like take a step. They're like, yeah, I think I want to do treatment. Do you know where, if there is any good beds open or whatever, right? Sometimes, if we're lucky. If not, we'll end our summary and we'll have improved the relational aspects of this, right? We'll have improved our relationship together, and planted some seeds for change. In that vein, planting seeds is one of the skills of motivational interviewing. So I'll take you through this really quickly. And it's really meant for people who are at the stage of pre-contemplation. They don't even really see a problem, right? And so we need to develop some discrepancy between the things they want and what they're doing. You want to live in this apartment for the rest of your life. This is like your permanent home, and you want to stay here because you love it here. But you're also throwing banger parties every night, and the landlord doesn't like that. That's a discrepancy. And we need to kind of like uncover that discrepancy with people, right? And we can do that. We'll hope to do that by having the client themselves provide the reason for change, not us. Here's where we get to age ourselves a little bit, date ourselves. One of the kind of key ways of planting seeds is to use the Columbo approach. And so if you're not familiar with this person on the screen, this will be a meaningless now metaphor, but this is Peter Falk. He was a detective in a show called Columbo. And what he did was he was really sharp and he had a sense of like what really occurred in terms of the crime. But he kind of came across as like a bumbling, unassuming person. He would kind of just ask a lot of questions. I'm just asking questions. I don't understand, right? I don't get it. I'm so confused. He would kind of come across as. Um, and so he would kind of make these reflections to piece together a larger picture of what happened in the crime. And then people would give themselves away, right? It's our uncertainty as a staff member, and then having the client kind of fill in the gaps. You're like, I don't get it. You really, really want to have your kids custody and Department of Human Services is saying you can't have drug paraphernalia out on, but like every time I come over, there's sharps on the ground. I'm so confused. Help me understand what's happening there, right? And then clients fill in the gap, right? Well, I've really been struggling with my drug use and um, or everybody keeps coming over and I don't know what to do. They fill in the solution, they fill in the gaps. And then we'll use ask, offer, ask also to plant seeds, right? Which I talked about already. But, you know, what do you know about this? Would you be interested in hearing more about this? What do you make of that information I shared? How can I be most helpful? Ask, offer, and we can get into a nice rhythm with people um, while we're continuing to share information, continuing to plant seeds for change, and then reflecting it back to them. All right, Kyle, you want to talk about hope and confidence?
Yeah, so this is the kind of specific tool I was hinting at the beginning of the training. Actually, I think I'm a slide. Oh no, this is correct. Yeah. So this is a tool that we call the readiness ruler here. This is something that another thing that sounds fluffy and light, right? But in motivational interviewing, and I think specifically when it comes to change behavior, something a client either wants to stop doing, like a substance or like some sort of like self-harm behavior, um, can be really useful, right? This again promotes self-efficacy and like encourages the client to think about the tools that they already have to engage in this change. And we can use open-ended questions to ask more about somebody's readiness and ability, right? I've seen this in another forum where it lists importance, ability, and confidence, right? Ability and confidence can be similar, but I think we can also make some distinctions here. But asking a person how important a change is to them might be the first step to treatment planning, period, right? In general, because if they don't think that this goal or what they're receiving from your agency is at least somewhat important to them, right? The idea that it should be more important or will become more important is worth talking about, right? Because then we're talking about, is this the agency for you, right? Do we have kind of what you're looking for to receive in treatment or in services, right? So engaging the importance of that change is going to be really important. Um, and then also somebody's confidence. And an example of what an open-ended question might look like in this example is if somebody believes that their ability and confidence to make any sort of effective change in, let's use substance use as an example, if they're like, I feel like a 2 or 3 right now, an open-ended question might be, what would it feel like, or what would you need to be at a 3 or a 4? right? That is an open-ended question. That is getting somebody to think about the supports that they might need or the supports that their clinician or providers may be able to support them with, to kind of increase their confidence, right? Because if we're increasing confidence, we are increasing somebody's likelihood to kind of move toward that kind of motivation space that we're looking for, right? The belief in the benefit and of the change and confidence in their ability to kind of make that change.
All right. This is the portion where I kind of speed run the stages of change. And the reason I'm going through it somewhat quickly is that it really is distinct from motivational interviewing. Useful for sure, but distinct. So if you're not familiar, this is the trans-theoretical model of change. And it is one theory of change among many that exist out there, but it's one that has gained kind of a lot of staying power. It pulls in several theories of change into kind of one cohesive model. And we're familiar, in my work, we have always just called it the stages of change, right? But the trans theoretical model is its full name. So it includes all these components. I'll go through them quickly here. It starts with pre-contemplation, right? Where a person doesn't have any intention of changing their behavior. They don't even recognize that there's a problem here, right? And at this stage, in terms of motivational interviewing, we're like very much keyed in on developing rapport with people. We have to be in relationship with folks before we can even consider trying to get them to move towards contemplation, to start thinking about possible change. So we're developing rapport. We're not confronting, right? That real talk. Hey, you got to change. Like that's not going to work here because they're not change isn't even on their radar. We are eliciting or developing discrepancy, right? So we're having people describe the way that their choices are either supporting or undermining their own goals. And that has to come from them. Tell me about that. Tell me about yourself. As I'm getting to know you, I want to know how your choices fit into your larger life picture. We can start to explore the pros and cons in a very non-judgmental way, right? Explore the change talk versus sustain talk. Tell me about both. What reasons do you have to keep you drinking? What reasons do you have to keep to stop? We want that to be part of our conversation. The next stage is contemplation, where people are aware that there's a problem there, but they're not willing to do anything about it yet, right? Like, I'm getting a lot of feedback. I'm kind of uncomfortable, maybe physically, maybe mentally, maybe emotionally, but I'm not ready for a change yet. And so here we're trying to elicit more positive statements for change. We're trying to tip the balance toward change, right? So we're using a lot of reflective listening and summarizing to, pull that out, open-ended questions, pull it out, and lean on the change talk. We are continuing to examine the pros and cons. And here we start to emphasize the pros a little bit in a gentle way, where we're not causing resistance. Yeah, that's what I'll say there. The next stage is preparation, where people are starting to ready themselves for change. They want to take an action, and they're not quite sure what to do yet, or they're starting to formulate their plan for what to do to make a change in their life, right? And so here we're helping people clarify their goals. Sometimes that means bringing it down. I get that you want to be an astronaut. Maybe we can work on community college first, right? And it's a silly example, but one that has always been helpful for me in like amplifying what we're actually talking about here. So we're helping people clarify their goals. We're considering possible barriers, and we're exploring what somebody's expectations might be if and when they make a change. We are, continuing to kind of explore decisional balancing. If you make this change, what will it look like? If you don't make this change, what will it look like? Asking a lot of open-ended questions, educating on options, and offering options of tapering down. I think kind of aligning harm reduction here. We're not always talking about substance use when we're using stages of change in motivational interviewing, but when we are, I think about harm reduction here, where somebody says, I have to get off of dope. Like, this is just not working for me, right? And they're like, I'm going to stop using as of tomorrow. And it's like, well, have you considered that maybe we can shoot 2 bags less tomorrow and see how that feels, right? It's kind of offering options for tapering toward change rather than the like all or nothing approach that sometimes people are ready for or think they're ready for, and it leads to more failure. So considering like moderation. Finally, people get into the action stage, and we're just like helping affirm, doing a lot of affirmation and summarizing as people develop their own plans for realistic change. We're offering, again, more education, helping strengthen their support network so that they feel supported and like able to make this change. We can use the readiness ruler in terms of like confidence, assessing, doing some self-assessment around confidence and helping build networks of support with people. Then we're in the maintenance phase where people have made a change and they're actually sustaining that change for some length of time. So exciting. I think really cautious here that we're not like celebrating so much that it feels like a failure to us when relapse inevitably occurs, relapse of the behavior that was changed, right? And so we're like so excited and putting so much pressure on this particular change that it invites a ton of shame when people inevitably relapse, right? So broadening support, a lot of affirmation, continuing to review the long-term goals and relapse and prevention plans here. Finally, people will relapse. They'll fall back into old patterns of behavior as very common and expected and should be normalized. And so our effort is to help people re-enter the change cycle. Where do we need to review? Do we need to make different preparations? Do we need to contemplate your reasons for change in a more careful or studied way? And we'll see this relapse as a learning opportunity. And then finally, assisting folks in building alternative coping strategies when we see a relapse. All right, let me pause here. I know we've been talking for a while. What questions or comments do you have? Is it making sense for you? Is any of this not new? Just want to check in with you before we move into a very, very brief practice session here. All right, let's get into it. So we are going to open some breakout groups, and we're going to just do it for maybe like 6 minutes, 3 minutes at a time. And what I would like for folks to do is in groups of 2 or 3, have the role of a client and a staff member. The client will be the one who identifies the change issue. I think feel free to use something from your own life that feels like that there's some levity there. Like I might decide I want to change my relationship to Doritos. Cool. Totally fine. Or you can also choose a change item from work that you're doing with a client. Maybe a person who's wanting to change their relationship to substances or mental health meds or tenancy stuff, right? So the client picks the issue. The staff should be focused on using ORs. Okay. So every statement that you make as a staff member, and this is going to feel a little stilted, a little stiff, but you should be using an open-ended question or an affirmation or reflective listening or summarizing. And I'm just wanting you to kind of continue to get comfortable with like building these into your general conversation with a client. Your goal is not to get this person to make a change today. Your goal is to build relationship through ORs around a change issue. If there's a third person in the group, I want you to focus on any examples of change talk or sustain talk that you heard. And so this will be on your screen. You'll get a chance to like see change talk statements or identify like what type of change talk statements that you've heard. Okay, so I've got a bunch of breakout groups with 2 to 3 people in them. Choose one client, make a switch at the 3-minute mark so that you can get a chance to be both a client and a staff member. All right. I'm gonna send you in. Wait. Bum, 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 bum. Here we go.